a terminal illness related to it, and then on top of that depression, it can lead to suicide. If they are, if they're seeing multiple clinicians multiple doctors at once, and it can lead to substance abuse, prescription pain medicine abuse, self-medication with alcohol or other drugs. They're not finding a cure. No doctor is telling them, listen, you have this disease, we're going to cure it. They're never finding an answer. So, you know, substance abuse dependence, depression, suicide are all high-risk factors for people that are suffering with this condition. They also have symptoms of anxiety and depression, so that might be what leads you to meet a client with this type of disorder in a mental health setting. They might not come in for their pain, but more for their symptoms of anxiety and depression. Let's see. So these types of disorders can occur at any age. There's differences between the type of symptoms that males and females present with. Females are found to have more types of migraines, tension headaches, and musculoskeletal pain. It's really hard to know what the prevalence is because of lack of, you know, people getting treatment for it. But within any given year, 10 to 15% of adults in the United States have some sort of work disability related to like chronic back pain, but it's unclear about how many of these would meet criteria for pain disorder. So if someone has acute pain disorder, which lasts less than 6 months, they're maybe likely to have an anxiety disorder. If their pain lasts more than 6 months, they're likely to have anxiety disorder and also have a depressive disorder. And there are different influences in how a person can recover from pain disorder, and it has to do with whether they acknowledge the pain, whether they give up effort to control the pain, whether they participate in regularly scheduled activities despite the pain, if they're still going to work, or if they're, you know, decide to give up on work and just let the pain become their primary focus. If they recognize and treat their comorbid disorders, so if they get treatment for their anxiety and depression, if they're able to psychologically adapt to their illnesses, and if they allow the pain to become the determining factor of their lifestyle. And the more areas of pain that they have and the higher number of symptoms, those people have a poorer prognosis than people who have less amount of symptoms. And there's a familial pattern. Depressive disorder, alcohol dependence, and chronic pain are more common in first-degree biological relatives of individuals with chronic pain disorder. And then for our client, Pam, who you guys will meet shortly, we're going to be treating her in an outpatient pain clinic. Our social worker will be an active role in assessing, diagnosing, and providing therapy to our client. And she is a very wealthy young lady with insurance, and her insurance company will reimburse the social worker so that we get paid. And now Lynn will be talking about assessment and the first steps that we'll be doing. So take it away, Lynn.
Thank you, Meredith.
Thank you.
So as Meredith said, the main feature of somatoform disorders are the client experiences pain or, you know, some sort of physical complaint. So the most important thing, or, you know, the first step is for the person to be evaluated by medical staff, you know, by a doctor. Most commonly, the clients will present to a doctor, hospital, you know, some kind of medical facility, because that's what they're experiencing, is the physical complaint. Sometimes they might come first to, you know, to some kind of mental health clinic, maybe for depression, you know, because of their physical complaint, you know, saying I have headaches, I'm depressed because I get headaches every day, or maybe anxiety, you know, because of their physical complaint. So if in either case they need to have a medical evaluation first, so if they come to a mental health clinic, they should be referred for for a full medical evaluation before anything else is done as far as their mental health assessment. But then if they have their medical evaluation and the doctors can find either any physical cause for their complaints or some physical cause, but not enough to for the level of symptoms that they're having, then they would be referred to for a mental health evaluation. So, of course, the assessment should include a thorough biopsychosocial assessment, as we would do for every other client. And then if they have medical and mental health records available, both present and historically, that's really helpful to review those. Usually with somatoform disorders, the person will have a history of complaints and see numerous doctors. It's also helpful to review with the client a timeline of their physical symptoms, what were their history, when did this first start, what was happening in your life when it started, and if the symptoms have come, if you look back at the history and the symptoms have come and gone over time, it's good to talk about, what was happening in your life when they came, what was happening when they went away and when they recurred, to kind of get a timeline to look at the whole picture of their symptoms and also, what was happening psychologically and emotionally and in their life. And then it's also recommended if they can keep a pain log of their, well, in this case, it's pain, but a record of their current symptoms. So with the person we're going to talk about for this case, Pam, at the pain clinic, she was asked, just to record over whatever period of time we're looking at, maybe a couple of weeks, just a daily record of when she has her physical complaints, when they feel better, when they feel worse. And then the final step in the assessment process is that there's different instruments that can be used to help assess. There's several different ones. Ones that's commonly used is the SOMS, and I'll pass it around. It's a fairly, this one's a fairly brief one that the therapist can give, complete with the client, and it asks about over the past 2 years all the different physical complaints, and asks about their history of seeing doctors and what came out of seeing each doctor. Did they get treatment, or was no cause found? So look at that one. It's also important to talk to the client about their culture, because cultural factors can can have an effect. Some cultures are tend more to express their emotional and psychological symptoms in somatic symptoms, physical symptoms. In other cultures, in some cultures it might be more common, say, if a person is feeling depressed, to come in for stomach ache or headaches or muscle pains, and they may not have a somatoform disorder. It may be more that that's what's traditional in their culture. And additionally, there's in some cultures there's different syndromes which seem kind of odd to us. There's one in Asian cultures, I think maybe in China, called Karo, and that's the belief that your genitals are retracting into your abdomen and you're going to die from that.